Let's move to a seated position in your chair. All you need is your red loop band, and you're going to sit in your chair. Now, make sure your feet can be solidly planted on the floor in whatever chair you're in, and that your thighs are below the bony protrusions of your hips. So it's a sign the chair is not the right height if your thighs are higher than those bony protrusions of your hips. That's going to make those hip flexors tighter. The band we're going to bring around our metatarsals with our legs a little wider than hip distance apart. We're going to do eversion footwork to work the lateral intrinsic muscles of the feet. This is great for, it's an injury prevention tool for proprioception. We're going to take our hands into what looks like a choir position, interlace the fingers, pulling out, engaging the back. So every time, we'll start with our dominant tighter foot, we evert the foot. I want you to pull out with the hands as well. And then when it comes back in, you can slacken in on the pull of the hands. So exhale, pull out on those hands, evert, and try to move from your ankle joint. No movement at the knee, thigh. So really isolate and move from the ankle joint. Take it out. So it's very small, very small. 2, 3, 4, and in. 2, 3, 4. Give me 2 more on this side. Take it out. 2, 3, 4, and in. And make sure it's around the baby toes. It's around your toes, not the arch of the foot. 1 more. Now, the other thing is, watch out for the neck. We don't want to strain it here. Keep your focus up higher than eye level, shoulders plugged down. Let's switch sides. So you can switch the hand on top too. And pull out as you're taking the foot out, eversion. Watch out for the knee moving, the thigh, the hip flexor. If you feel gripping in the front of the thigh, just try to relax it. Maybe squeeze your butt. Squeeze the opposing muscle to sit up taller. Pull your inner thighs back like you're pulling them back to the wall behind you, so you sit up on the top of the sits bones here. And move from the ankle joint. Just another 15 seconds or so of movement here, keeping the gaze higher than eye level, using your breath. From here, we're going to put the blue loop band back around our ankles. If at any time you feel this is too much and you're feeling joint pain versus muscles recruiting, because we're going to be targeting the hamstrings with a step through space hamstring kickback, just like we did on all fours, but now standing in the frontal plane. We need our 5-pound weight in our hand, and we'll do this by a wall for injury prevention. We'll do one side twice, and then we'll do the other side twice. So you'll be stepping towards the wall with the weight in your outside hand. The inside hand will be, so profile to me. There we go. And the band is around the ankles. So start about a foot from the wall because you're going to step towards the wall. So bring the other hand to the hip, the non-loaded hand to the hip, and the other, the loaded hand to the shoulder. So I want it to be in a shoulder press. You can take it up to the press for now and just isometrically hold it in the press. Soft bend in the elbow. You're going to step towards the wall. Inside leg is your balancing leg. Outside leg is going to come into the band. And I want you to kick back. Do a hamstring kick back. Hold it here. Good. Inhale 1, breathe. Exhale 1. You can move the leg in and out if the band's too heavy. Inhale 2. Exhale 2. Inhale 3. Exhale 3 and bring it back in. Correct. Step back to me and we'll repeat. So remember, you have to bring the arch of the foot into the band, and that weight is just going to be in a nice shoulder press, loading, adding some resistance. So stepping to the side, finding the balance, arch of the foot into the band, hold it here. Inhale 1, breathe. Take the gaze up higher. Exhale 1. Inhale 2. Exhale 2, soft bend in the supporting knee. Inhale 3, low belly firm. Exhale 3, and let's turn around and switch sides. So traveling through space, finding the balance on your standing leg, taking the weighted arm up overhead, loading the back of the shoulder, building that bone density here. And the outer hip, standing on one leg helps you build up that outer hip. And we know how important the hip strength and the bone density is with osteoporosis. So step to the side, find the balance, and then bring the arch of the outside foot into the band, hamstring kick back, find it, hold, inhale 1, breathe, exhale 1. I'll show you the in and out so you can move that leg in and out like you did on all fours if the band is a little heavy. Inhale 2, exhale 2, inhale 3, Exhale, 3, and step back to me. Final set. Watch out for the eyes. They help the neck, so keep the eyes up. And final set. Step through space. Find the balance. Hamstring kick back. Soft bend in the supporting knee. Deep lift to the lower pelvic floor. Inhale, 1. Breathe. Exhale, 1. Inhale, 2. Soften the front ribs towards the back ribs. Exhale, 2. Low belly firm. Inhale, 3. Exhale, 3. Great. Let's set those props down. Now, the blue band, we can pull the blue band up around the outer thighs. And I want you to grab your trigger ball and your yoga block. And then you're going to come to lie supine on your foam roller with your trigger ball and your yoga block. And take a moment to get on there. You can set the block to the side and the ball for a second. As you get on the roller, find your balance first before picking up the props. Tailbone at the bottom, head at the top. We're going to roll out the fascia around the shoulders and the pecs, the chest area. I want you to do this very gently. If you notice you're on bone, move away from that. Try to find fascia. So even around the breast, laterally, like near the armpit area, you can even get some of the pec muscles there, but be very gentle as you're doing this. So grab your trigger ball and your block, and you're going to pin the ball with the block, using the block, and you can always use a book if you don't have a block. And you'll hold the block with both hands. Make sure your feet are hip distance apart so you have extra security here. Neutral pelvis, abs engaged, and begin rolling. What's nice about this is we're recruiting the internal abs to stabilize here. We're a little unsteady. And then we're also doing a nice self-myofascial release for an area that's posturally tight, and we most likely are not getting any sort of massage work in this area. So this is self-care and important to combat kyphosis that we release this tight area. So front of the shoulder, around the breast, that means also medially, like into a V-neck line. Goes very slow here, especially because you have osteoporosis. If you're on bone, move away from the bone into the fascia, circular motions. Should feel nice, may feel really tender. Perhaps it is really tender, and in that case, back off a little, be gentle. Keep breathing here. Let's make our way to the other side now if you've been on one side. If you've been moving all around, then continue to move all around for a minute. I find that under my armpit, like below the breast, right on the side of the body near the rib cage, is really tender for me. That may be an area you want to explore. It's a harder area to get when you're lying, but the block does, especially a foam yoga block, will make it your job a lot easier to pin the ball. Keep breathing into that. Another 30 seconds here. Notice where your pelvis is in space. If you're arching it deeply or rounding it, see if you can send it into a neutral position. If you can breathe into the side body, breathe into the areas that you're rolling as opposed to the belly, keeping the belly firm to support your movement. Just another breath here, and then I'll have you set those props to the side, bracing your abs, and slowly making your way off of the roller. Hands on the floor, coming off to one side slowly. And let's come up to stand. We're going to release the soleus. You can keep the band on the thighs. You're going to come into a staggered stance. So it looks like this, one foot in front of the other. It's not wide. Turn and face a wall in this staggered stance. Start with your dominant tighter leg back. Brace your abs. This is the only time I'm going to have you tuck your pelvis under like a scared puppy. You're not loaded, so it's okay. And push the pelvis forward towards the wall. Chin and chest are up. It's very important that the head is up on the spine here. Push the pelvis forward, deep bend in the knees. Just getting into the soleus, the inner calf muscle. So make sure if I drew a line from your back toes, it would hit your front leg's heel. So that foot is only a foot behind the other. It's not a wide staggered stance. Bend the knees, tuck the booty, drive the pelvis and body forward. Lift your gaze higher, bring that head up a little higher. Breathing, and step the back foot forward. This is just a release for that internal calf muscle since we did that balance work. Bend the knees, Tuck the booty, drive the pelvis forward, soften your sternum. Breathe here. Inhale 1. Exhale 1. Inhale 2. Exhale 2. Inhale 3. And exhale 3. Stepping that back leg forward. Great job.